20 minutes. That's how long this trip lasts. The Pentagon thinks that's the feature, not the bug. This is the story of 5-MeO-DMT, the compound the Department of Defense just named in federal law, the one Utah just funded with $1 million of taxpayer money, and the one Wall Street is racing to bottle before the FDA approves it.
This is Psychedelics University, the science, the medicine, the future.
5-MeO-DMT is a tryptamine. Chemically, it's a cousin of regular DMT and a distant cousin of serotonin, the neurotransmitter your brain uses to regulate mood. It occurs naturally in dozens of plants, in some species of fish, and most famously in the venom of the Sonoran desert toad. Indigenous communities in northern Mexico have used it ceremonially for centuries. Today, every dose used in a clinical trial is synthetic, manufactured in a lab to pharmaceutical-grade purity. The compound is roughly 4 to 6 times more potent than regular DMT. When inhaled or insufflated, it produces what researchers describe as the most intense and shortest psychedelic experience in modern medicine. Peak effects in under 1 minute, full return to baseline in 20 to 40 minutes. That speed is exactly why the Department of Defense is paying attention.
Here's what happens in the brain. 5-MeO-DMT binds primarily to the serotonin 2A receptor, the same receptor psilocybin and LSD activate. But it does it harder and faster. Brain imaging studies show the compound temporarily collapses what neuroscientists call the default mode network, the part of your brain responsible for self-referential thought, rumination, and the constant inner monologue. For depressed and traumatized patients, that network is overactive. It's the loop they can't escape. 5-MeO-DMT turns it off. 20 minutes later, the network comes back online, but rewired. Connections that were stuck become flexible again. What do patients report experiencing during those 20 minutes? In Johns Hopkins surveys, the most common descriptions are complete ego dissolution, the sense of self temporarily disappears, a unified field of consciousness, profound peace, what researchers clinically call a complete mystical experience, scored on a validated scale, occurs in roughly 75% of sessions. That score, the mystical experience score, turns out to be the single strongest predictor of clinical improvement. Patients who report the most dissolution improve the most. Researchers call this neuroplasticity. Patients call it relief.
If you watched episode 4, you already know part of this story. In 2023, Stanford researchers published a study on 30 special operations veterans who traveled to Mexico for an unregulated psychedelic protocol. The treatment was ibogaine, followed by 5-MeO-DMT. The results, published in Nature Medicine, showed an 88% reduction in post-traumatic stress disorder symptoms, an 87% reduction in depression, and 81% reduction in anxiety. Average improvement on disability scales? More than 3 standard deviations. For context, FDA typically approves an antidepressant if it beats placebo by 2 to 3 points on a depression scale. The Stanford veterans improved by an average of 31 points. That study did not happen in an FDA trial. It happened in a Mexican clinic because both compounds are still Schedule 1 in the United States. But it triggered everything that came next. 2 companies are now racing this compound through FDA trials. The first is ATAI Beckley, a partnership between American biotech firm ATAI Life Sciences and the Beckley Foundation, the British psychedelic research organization founded by Lady Amanda Fielding. Their drug is called BPL-003. The active ingredient is mebufotenin, a synonym for 5-MeO-DMT. They deliver it as a nasal spray. In July of 2025, ATAI Beckley reported Phase 2B results. 193 patients with treatment-resistant depression. Single dose. Primary endpoint at day 29, a 12.1 reduction on the MADRS depression scale. Placebo-adjusted. Statistically significant. Durable. The 8 mg dose is now advancing to Phase 3. If approved, BPL-003 would be the first FDA-approved 5-MeO-DMT therapeutic in history. The second company is GHRS, an Irish biotech now public on the Nasdaq. Their drug is called GH001. Same active ingredient, mebufotenin, but delivered as an inhaled aerosol. The patient inhales the compound through a custom device, and the experience peaks in about 90 seconds. GH Research's Phase 2b numbers are, frankly, some of the strongest depression results in psychedelic medicine. Negative 15.5 MADRS reduction, placebo-adjusted. 57.5% of patients in remission at day 8. 73% still in remission at 6 months from a single treatment. For comparison, standard antidepressants like Prozac or Zoloft take 6 to 8 weeks to work, help about 30% of patients reach remission, and require daily dosing for years. In June of 2025, GH Research published Phase 2a results in postpartum depression. 10 women, 100% remission at day 8. The trial was so successful, the company is moving directly to a registrational study. Here's where it gets unusual. In late 2023, Congress passed the National Defense Authorization Act with a quiet provision tucked inside, Section 723. The provision authorized the Department of Defense to conduct clinical trials of psychedelic compounds on active duty service members. 4 compounds were named by federal law: MDMA, psilocybin, ibogaine, and 5-MeO-DMT. That last one is the headline. The Department of Defense is now legally authorized to dose Navy SEALs, Green Berets, and other special operations personnel with a Schedule I psychedelic that lasts 20 minutes. The reasoning, according to military medical officials, traditional PTSD treatments fail roughly 40% of veterans. Suicide rates among special operations veterans are catastrophic. And the 20-minute duration means the compound is operationally compatible. A soldier can be treated and back to baseline in less than an hour. Stanford's neuropsychiatry program at the VA Palo Alto is one of the lead research sites. The first DoD-funded trials began in 2025. While the Pentagon was working at the federal level, Utah moved at the state level. In March of 2026, Utah Governor Spencer Cox signed House Bill 390 into law. The bill allocates $1 million in state funding to the Huntsman Mental Health Institute at the University of Utah to conduct clinical research on 5-MeO-DMT for veterans with post-traumatic stress disorder. This is the first time in American history that a state government has directly funded research on this compound. Utah is now ahead of Texas, which we covered in Episode 4, and ahead of every other state. The research will be conducted under federal Schedule I protocols, which means DEA authorization, controlled substance licensing, and full FDA oversight. The first patients are expected to enroll in 2026.
Back at the federal level, another bill is moving through Congress. House Resolution 2623, the Innovative Therapies Centers of Excellence Act. If passed, it would establish 5 dedicated centers within the Department of Veterans Affairs to research psychedelic-assisted therapy. Funding, $30 million per year. Compounds covered, psilocybin, MDMA, ibogaine, 5-MeO-DMT, and ketamine. The bill has bipartisan sponsorship. It's exactly the kind of structural legislation that turns a research curiosity into a permanent medical institution. If this passes, and the political momentum suggests it will, the VA will become the largest psychedelic research organization in the world.
And here's the contradiction at the center of all of this. 5-MeO-DMT remains a Schedule I controlled substance under United States federal law. That means it is officially classified as having no accepted medical use and a high potential for abuse. The same classification as heroin. At the same time, the United States federal government is funding Phase 3 trials, authorizing the Department of Defense to dose active duty soldiers with it and writing it into the National Defense Authorization Act by name. This is the Schedule I paradox. The drug war framework from 1970 is colliding with the clinical evidence from 2026. Something has to give. Most observers in pharmaceutical regulatory affairs expect rescheduling to follow FDA approval, likely to Schedule 4, which would put 5-MeO-DMT in the same category as Xanax.
The commercial implications are significant. ATAI, Beckley, and GH Research are both publicly traded. Both are racing to be the first FDA-approved 5-MeO-DMT therapeutic. Investment bank analysts project the global market for psychedelic medicines to exceed $10 billion by 2030. Whichever company crosses the finish line first will likely capture a major share of the depression treatment market, a market currently dominated by daily-dose antidepressants generating tens of billions of dollars per year for traditional pharmaceutical companies. The question is not whether this drug becomes a medicine. The clinical data already answers that. The question is who owns it, how much it costs, and whether the indigenous communities who used it for centuries will be acknowledged when synthetic bupropion generates its first $1 billion in revenue.
Step back for a moment. 20 years ago, the idea of the United States Department of Defense funding research on a toad venom-derived psychedelic would have been unthinkable. Today, it's federal law. 20 years ago, the idea of state taxpayers paying for Schedule I psychedelic research would have ended political careers. Today, Utah did it with bipartisan support. The reason is simple. The traditional mental health system is failing. Suicide rates are at historic highs. PTSD treatments fail nearly half of veterans who try them. Standard antidepressants help only a third of patients reach remission. 5-MeO-DMT in 20 minutes has done in clinical trials what daily medication has failed to do in decades. That is why the Pentagon is paying attention. That is why Utah wrote the check. And that is why, within the next 2 to 4 years, this compound will likely be a prescription medicine in the United States.
This is Psychedelics University, the science, the medicine, the future. Next week, we cover MM120. MindMed's once-and-done anxiety treatment, now in Phase 3 trials. If you want to understand the medicine that's about to reshape psychiatry, subscribe for more buried science.